Many of you have been sharing with us a viral video of a patient at Conemaugh Hospital who says she has symptoms of coronavirus but wouldn't get tested or treated. 6 News investigative reporter Crispin Havener has been asking questions about local testing, and he looks into why no test was done.
Just heed the warnings.
This Facebook video posted Tuesday night by Misty Vukovic sent shockwaves across local social media.
I know it's hard to say, but I don't ever want to feel like this.
Vukovic says she went to an urgent care Tuesday after she says she began developing a cough, a burning feeling in her chest, and shortness of breath, symptoms of coronavirus. She says they sent her to Conemaugh Hospital, where she alleges nurses wanted to run tests, but the doctor said no. She says little was done for her, and no COVID-19 testing was done before she was discharged, saying on Facebook, quote, "Do you know why our numbers are so low in our county? Because Conemaugh does not test for COVID." I reached out to Vukovic Wednesday to learn more about her case. She said she was too sick to talk, but did send me her discharge papers and answered questions through text messages. Her paperwork shows that Conemaugh staff did do a portable chest x-ray and diagnosed her with shortness of breath and cough, 2 coronavirus symptoms. The summary also said her temperature was normal, as was her respiration rate and oxygen saturation levels, telling her to follow up with her primary care physician and self-quarantine. Still, the video left many wondering why she wasn't tested, given she showed some mild symptoms.
From WJIC,
It's a question we've posed before to State Health Secretary Dr. Rachel Levine.
Depends upon the seriousness of your symptoms. If you have a very low-grade fever, if you have a cough, but otherwise you're feeling well, then it isn't necessary. You can always call your healthcare provider, but it is not necessary to go to an emergency department because, again, there's no treatment, and so you should stay home. If you're developing high spiking fevers, if you're developing a more serious cough, shortness of breath, labored breathing in any way, then please either contact your healthcare provider to discuss that, or if the symptoms are an emergency, go to the emergency department, and there, of course, you will be tested.
She says the main reason for that is there are simply not enough testing supplies to test everyone.
If we were going to move to a different type of testing, as had been done at the very beginning in Singapore and in Hong Kong, which involves much more mass population testing, we do not have those supplies. No state has those supplies at this time.
So they're focusing on those with severe symptoms and other high-risk patients, along with frontline healthcare workers and those in nursing homes who become symptomatic. And that matches federal guidelines.
Not every single person in the United States needs to get tested.
While more than 1 million tests have been done nationally, the feds admit more tests need to be done.
What you want is to really get the handle on those areas where they don't have a lot of infected individuals, where you want to effectively identify, isolate, and contact trace. You want the result of the test in real time.
Leaving folks in a gray area, like Vukovic, as she painfully walks the road to recovery.
Be careful. Stay healthy.
Vukovic told me that she reached out to her primary care doctor and is now under self-quarantine. We also reached out to Conemaugh Hospital for comment. A spokesperson told me they can't get into specifics with Vukovic's case, but said Conemaugh is testing patients for COVID-19, and we have been for weeks. In many of these cases, patients without symptoms or mild to moderate symptoms will likely not be tested for the virus, as a positive test does not change the course of the illness, and there is no treatment for COVID-19 at this time. Crispin Havener, 6 News.